Start the recording. Okay. Good evening, everybody. Welcome back for day 2 of our 6th annual virtual diabetes symposium. Thank you for being here. Get started. If you were here last night, you know I'm Sarah Bloom, and we are the Delaware Diabetes Coalition. We're a statewide nonprofit organization that is a network of healthcare organizations working together to improve the lives of all people in Delaware with diabetes. We do that through awareness, prevention, identification, dissemination of services, and advocacy. We also do 2 big events a year, this being one of them, and the other one is our statewide expo held in November for National Diabetes Month. It's more geared toward type 2 and is a day for them to come get education and resources from vendors. So to recap who our audience is tonight, it's a mix of school districts, education, school nurses being the majority of our attendees, 28 different healthcare organizations, and 24 from other organizations. Geography, we have 13 states represented. We had over 300 people register for the 2 nights, which is the first time we've ever broken that number. And the audience, again, registered nurses, registered dietitians, CDCESs, pharmacies, pharmacy techs. This all started because I needed an outlet to be able to advertise our college scholarship. We offer $1,000 a year to any type 1, type 2 Delaware student, be a high school senior or somebody that's already in college. And we weren't receiving applications. This, as well as other outlets, have expanded that, and we now do receive a good amount of applications, but please continue to spread the word. Our application is due April 30th of this year. Another program we offer is through the Lions Club of Delaware, the Lions Empowering School Nurses for Children with Diabetes. And it's a 3-level diabetes training for all Delaware schools. It can be, if you are a school nurse, you can get 6 CEs for free each year. So we're in the 2nd year of the program. It is also open to coaches, teachers, cafeteria workers, administration, school bus drivers, parents, anybody within the school that needs some kind of maybe fast track diabetes education. It's a great resource. And we are growing the program. Over 2 years, we've had over 550 enrollments. 71% of Delaware school nurses are participating. And of the 266 school sites, we have 209 schools have some kind of active participation. So we are still growing that. If you need help with any of it, Amy Hastings, who I was remiss at the beginning to give a shout out to getting our fabulous speakers for last night and tonight. But she's our nurse facilitator and she can answer any questions or get you signed up. So this is the graph just over 2 years. If you're tracking from January of 25 to January of 26, you can see that we're behind, but we also had a lot more leading up to. But we would love to get back up into the 300s by June to be able to reach what we did last year. To receive your CEs for tonight, you need to watch the webinar, all 2 hours of it, 120 minutes live, and then complete your evaluation by March 1st. There will be an opportunity in the evaluation to put the email address that you are using tonight for login so that I can match your time here live with your completed evaluation. And you can get 2 contact hours for the following organizations from pharmacy, nurses, dietetic, registration, and diabetes care and education specialists. All speaker and planner disclosures are on our website. The learning outcome, I read it last night. I will save you that tonight, but you will definitely walk away with more knowledge and education from evidence-based strategies for prevention management and technology integration across the lifespan. And tonight we start with transitioning to adulthood with type 1 diabetes, resources and tips for success from Blue Circle Health with Carrie Matuzsan and Eleni Sheehan. And real quick, I will give you a it's my page. Synopsis of them. So Carrie is a case manager at Blue Circle Health and has lived with type 1 diabetes since age 12. With a background in medical social work, she supports young adults navigating the transition from pediatric to adult diabetes care, bringing both professional expertise and lived experience to her work. Eleni is a family nurse practitioner and diabetes care specialist at Blue Circle Health, diagnosed with type 1 diabetes at age 9. She focuses on supporting young adults in previously developed transition of care programs to help patients move confidently from pediatric to adult diabetes care. And so, with that, I will pass the baton off to you ladies. Thank you so much for being here.
Thank you so much for having us.
Let me stop share. There we go.
All right, great. Thank you so much. Let me pull up my slides. Okay, has that come across successfully so far? Okay, perfect. Well, thank you, everybody. My name is Carrie Matuzsan, and I'm here with Eleni. We'll be talking about transitioning to adulthood with T1D, resources and tips for success. As far as disclosures go, we do not have any relevant disclosures to disclose. And today we'll be presenting on understanding the transition for young adults from pediatric endocrinology clinics over to adult endo offices, discussing the transitions between or towards independence with T1D, including resources that can help out both providers and families, and learn how Blue Circle Health can help fill in gaps that happen in T1D care during this time. All right, I'll pass it over to Eleni for the introduction.
Yeah. Hi. So, Sarah, thank you for introducing us. I'll just say hi. I'm Eleni Sheehan. I'm a family nurse practitioner and CDCES with Blue Circle Health. I have been living with T1D for over 44 years. I'm from Gainesville, Florida. We have any Gators out there? And Carrie?
Yes, and like the introduction, I'm the case manager at Blue Circle Health. I've been living with type 1 diabetes for pushing 23 years now, and then I'm pretty local to Delaware myself. I'm from the Philadelphia area.
And I just also wanted to introduce another member of our team who has joined us this evening. Morgan Pansier is available if you all have any questions to type in the chat while Carrie and I are speaking. And then, of course, once we're done, we will also have a Q&A session as well. But first, we will start with just a really brief overview of Blue Circle Health here. In case you haven't heard of us, Blue Circle Health is a nonprofit organization working to improve how type 1 diabetes care is delivered and accessed. We are very grateful for funding from the Leona M. and Harry B. Helmsley Charitable Trust, which enables us to provide our 6-month virtual care, education, and support program to adults with T1D for free. We don't replace local in-person diabetes care. Rather, we act as an extension of the care that people already receive, and we keep them connected to their medical homes. So we work alongside existing healthcare providers and help to fill in the gaps in care and empower people with T1D to manage this condition. And of course, we know that one of those times in life when people are more vulnerable to gaps in diabetes care is during that time of transition from pediatric to adult healthcare settings. So let's explore that in a bit more detail. Next slide, yes. Okay, so let's talk about preparing for transition from pediatric to adult diabetes care. So one of the most common questions I heard in my pediatric endocrinology practice was, when do we need to make the move? And the answer which is an answer that I like to give for pretty much everything related to type 1 diabetes care, is it depends. So the American Diabetes Association guidelines recommend that there be no specific age cutoff for youth with diabetes to transfer to adult diabetes care. Really, the recommendation is for a collaborative decision-making process during which the young person with diabetes, their caregivers, and their pediatric diabetes care team get together and discuss their readiness and their preferences to ensure that the transfer to adult care aligns with their unique needs and circumstances. Ideally, pediatric diabetes care teams will implement transition readiness programs beginning in early adolescence and then at the very latest 1 year before the anticipated transfer to that adult program happens. Readiness programs should address not only diabetes self-management skills, but also related behavioral, social, and developmental factors. So for that, a multidisciplinary team is really best. It may include physicians, nurse practitioners, certified diabetes care and education specialists, school nurses, dietitians, pharmacists, behavioral health specialists, social workers, health insurance experts, and then, of course, let's not forget about resources to really enhance social and peer support. Many pediatric diabetes centers already have a transition preparation program in place, and they may have a specific cutoff age, say 18 or 21 years. And some programs may be flexible about that cutoff age, but others will not. Most pediatric healthcare centers have a transition policy in place that describes what families can expect to occur and when in preparation for that move to the adult clinic. And really, an overarching priority and transition preparation is to encourage young people to become more effectively engaged in their health care and to become active partners in this process. Next slide, please. So when looking at pediatric clinics compared to adult diabetes clinics, I find it can be really important to help manage expectations. Neither the traditional pediatric nor adult diabetes healthcare settings are ideal for the unique needs of emerging adults. So, what's the difference? What's the big deal? Well, one research study actually did examine perceptions and found that young adults with T1D have said that they view pediatric programs as family-centered, informal, and socially oriented. In contrast, they saw adult programs as more formal and with an emphasis on the risks of long-term complications. And I will share that as someone who has been in both patient and provider roles in both of these settings, I can say that that is a fairly accurate description. And while the PEDS endo may likely include caregivers and family members in decision-making and self-management considerations, the adult endo will more likely expect the person with T1D to handle these responsibilities autonomously. So here's some practical tips to share with teens and their families before making the transition. So one really important thing to consider is that upon turning 18, parents no longer have access to their child's medical information. That includes online portals. It also includes the ability to speak with providers without the teen present. So it can be really helpful for the family and caregivers to have this conversation with their teens before they turn 18. And then if the teen consents, they can have, they can sign a release of information consent form and have that on file at the clinic. Before the last visit with a PEDS provider, request 1 year supply of refills on insulin supplies. You just never know. Patients also, they can request that their medical records be sent along with the referral to that adult practice. But we also recommend keeping their online health portal with PEDS active at least until the first visit with a new provider, just in case there's a need to access additional information or history. And I would always, anytime I send a referral from PEDS over to adult, say, okay, write down. Here it is. Take a screenshot. Write it down. Do something. Note the name, location, and contact information for the place that I'm sending the referral. Many times they need to actually follow up on that referral and go ahead and schedule the appointment themselves. Another thing that we learned can be very helpful is to provide DME suppliers. So whoever sends those pump supplies, or if they get their CGMs from mail order, send that company the new adult endo's information. And it can, you can even go online and sign up in your healthcare portal and update that information. And to do that before there's a need for an urgent reorder of supplies. And then, so what to expect? Once that Peds Endo has sent the referral over to adult. Well, depending on your area, and I know we've got folks from Delaware and many other states, even over out in California. So depending on your area, there could be long wait times to get established as a new patient with an adult endocrinologist. So just some suggestions to help young adults stay engaged in care is one thought is to see if they can ask their pediatric endocrinologist to schedule one more visit. So I used to do this for my patients. I would, see them for the last visit. I'd send the referral, but then I would actually schedule one final visit with me for 2 to 3 months. And I would let them know, look, you can cancel this appointment with me once you've got the appointment scheduled with your new provider. But I found that this was really helpful in catching some of those roadblocks in the referral and transition process and making sure that kids don't get lost. And then another thought is that a primary care provider can absolutely help in the interim with prescriptions and just basic health maintenance until that first visit with the adult diabetes specialist. Next slide, please. So here's some helpful guidance to share with your emerging adults with T1D as they prepare for that first visit with the adult endocrinologist. Talk to them about empowerment and self-advocacy. Let them know that they are empowered to take charge of their diabetes clinic visits. And so one suggestion is to help them, prepare a checklist. Here are 4 things to discuss during your visits with your diabetes provider. And they can be these same 4 things or these 4 categories every time. So number 1, practical matters, prescriptions, insurance, coverage, accommodate, like maybe they need letters for school accommodations or travel. Number 2 is diabetes matters. So, for example, questions about insulin doses. They may be curious about how alcohol affects their glucose levels or things like that. Talk about those diabetes matters. Number 3, mental health matters. So, really encourage youth to speak up. If they've been feeling anxious, having thoughts of depression, or would like to speak with someone about mental health concerns, encourage them to not hesitate to ask for help. We are healthcare providers. We want to help. That's what we want to do. But sometimes we don't remember to ask about everything. So let them know that please speak up. And then number 4 category is prevention. So help them understand that complications associated with type 1 diabetes can be prevented and in some cases reversed. But the key is it's early detection. So help ensure that they have a dilated eye exam, labs at least every year, and a foot exam. And one kind of funny thing is, so, I was at the University of Florida and I started off in the adult clinic, and I was there for about 5 years. And then I moved over to peds. And in my adult practice, but see these kids come in and they would just freak out when I pulled out the monofilament. And I'm like, has nobody checked your feet before? What is going on in those peds clinics? So, I'd be like, okay, here's your induction into adult care. It's the foot tickle. So, it may be good to introduce the idea that checking their feet is something to do. But then when I was in peds, I would start checking their feet before sending them over to adult and say, hey, look, this is going to happen over there more frequently. Anyway, and before we move to the next slide, just a really quick note about reproductive health. So having a healthy pregnancy and newborn is thankfully within reach for most young women with type 1 diabetes. Having glucose levels in target at the time of conception is key. And it's very important to have a conversation about choices regarding sexual activity, contraception, and planning for pregnancy. And, right now we don't know of any contraceptive methods that are specifically off limits to women with type 1 diabetes. Of course, each person, has individual considerations and concerns. So, next slide, please. So I wanted to share this information with you. I have not personally used it in my clinic, but I came across it more recently, and I think it's pretty amazing. So Reboot Diabetes, they offer fantastic guidance on how healthcare providers can discuss all of these topics that I just mentioned. And they also provide tools to help individualize and prioritize concerns for each emerging adult. This is an online toolkit. It is specifically for clinics who care for young adults with diabetes, and it's based on research led by pediatric endocrinologist Dr. Jennifer Raymond at USC with funding from the Helmsley Charitable Trust. Really an amazing, it's a free resources that is evidence-based program put together, and it combines person-centered diabetes visits and virtual peer groups for young adults. And they provide clinicians with the tools and skills to engage patients and better understand individual concerns, along with structure to help young adults with diabetes connect with each other. So next slide, please. So this is just an example. On their website, they have all of these forms and plus more available, but this is just an example of how their tools incorporate motivational interviewing to engage patients and focus on their individual concerns. So they provide two versions of this topic choice tool. There's a patient version and a clinic version. The clinic sends it to the patient before the visit, and it's really just for the patient to think about what topics do they want to talk about at their upcoming visit. And the topics, I know that's super duper small. The topics that are listed there are checking blood sugar or adjusting insulin doses, treating highs or lows, technology and devices, medicine or supplies, mental health, sexual or reproductive health, healthcare or insurance changes, tobacco, alcohol, or drugs, school or work, and other. And then the clinic version of this topic choice tool has the same topics. And the clinician uses their copy with the patient at the start of the visit. And each one of them, the patient and the clinician, choose 3 topics that they want to talk about. And then together, they decide what to focus on during that session. And then at the end of the visit, they use this form provided by Reboot Diabetes, which is the action planning tool, to make a specific plan for the next steps. And the actions can be for either the healthcare provider or the patient. And the toolkit, they provide both print and web versions of all these forms. So you can use the one that best fits with your clinic workflow. In my pediatric transition clinic, we actually assigned forms kind of like this, questionnaires in MyChart. And so we would email them to folks in MyChart before they came to their visits. And if they filled them out, fantastic. If not, we would do them when we got there and go through anything that they were concerned about. So, and then the action planning form, it says, what is the action? Who will do this? What might get in the way? What could be helpful, and how will we check in about this? They also, Reboot Diabetes, on their website include training for skills based on motivational interviewing. And there's this whole series of videos demonstrating using these tools and having these conversations with young adults. So the link to their website where you can access all this info for free is on this slide. And now I will turn it over to Karen.
All right, great. Thank you. So Eleni's covered a lot about what teens and young adults will experience as they transition within the healthcare system, but changes in care are not limited only to the clinical office settings. So I wanted to highlight that school nurses are essential, as you already know, to students with T1Ds in their life in school. But as a student approaches the end of their time at high school, this role can continue on to help out with the transition. School nurse is often the last consistent clinical expert that the student interacts with before becoming fully responsible for their own safety and health in an adult environment. I wanted to highlight three main areas where school nurses can take leadership in assisting their students. But you know your students best, so you may know that some may need a little bit less support while others a significant amount more. So starting with the self-management assessment, you can assess readiness, similar to what Eleni spoke about with the clinical settings and some resources that I'll cover in a few slides. But especially if you feel like the student is not getting the level of support from their providers or from home life, having an assessment readiness scale done can help out to see where you can fill in some gaps. As a school nurse, I imagine that you've learned a lot about managing T1D and have even taught other school staff or anyone else throughout your career as a school nurse. But this knowledge can shine as you explore a student's ability to calculate insulin doses, navigate their pump or their CGM, check ketones, and manage some lows. And also using this knowledge, you can empower independence by shifting from a direct intervention, that's the style that you have for some younger kids, over to a more supportive coaching style as they're approaching adulthood. And that can look like whatever you feel like in your office, especially with the individual students that you have. Maybe as simple as asking a student what they believe they should do next versus doing some teaching if they feel like they need it. And last is encouraging autonomy. You can collaborate with the family if that feels appropriate, with a gradual increase in responsibility and having a goal of full independence by the time they're graduating from high school. Next, we'll focus on the legal and healthcare transition support. For one, there's going to be a transition of care. You can facilitate that transition to adult endocrinology, covering those new styles and expectations as Eleni has just discussed. Another area is discussing the 504 plan. Imagine that that's a conversation that you have frequently with students and with their families. But if the student or the family is not aware that that 504 plan or even their IEP is not going to transfer outside of the school. However, parts of it do, so you can provide some education about the legal documents, how it's connected to the Department of Education, how that relates to college settings, as well as what could roll over into the work settings. For post-secondary, you might run into disability services at different colleges or universities. And you might want to cover the rights through the Americans with Disabilities Act, which I'll talk about in just a few more slides. And then insurance and pharmacy might be something that you can touch on. You can discuss if there's an upcoming coverage change for a student, maybe check in on their understanding of how to get their supplies, what their costs might be. It might not be actual teaching based on the specifics of their insurance plan, but raising the topics, especially with an assistance like a transition readiness tool, can prompt that conversation between the student and their parents or the policyholder for the insurance. Okay, and then resource navigation and supply planning can be a role within school nurses as well. If you find that through teaching, through watching the student grow, they might really need a referral over to a certified diabetes educator to reinforce their management skills. If it feels like something that's lacking, that they're not quite picking up while in the school setting. Another could be the emergency supply planning. So imagine with the school nurse, if you're anything like my school nurse, I had a bucket of emergency supplies that was assigned just to me within the office, and making sure that they have a similar setting like that, know what type of emergency supplies they might need, like backup insulins, backup pump supplies, backup CGMs, and glucagon. As well as even sharing some emergency resources outside of the school and office settings. For one is getinsulin.org. It is a great resource for finding a short-term or even long-term solutions to make sure that anyone with diabetes is able to get their insulin affordably. Another is Danatech, which is the diabetes educator tool that has created an affordability tool so that you're able to find the different programs that offer pump supplies and CGM supplies even more affordably. Lastly is tech management. You can check in with the student about their understanding of the pump download to be able to further assess and assist their adult endocrinologist, and also just for themselves to be able to view their own data and make sure that they have a full understanding of the data that they have, how to utilize that technology, and make that transition over to the adult endocrinology team. Okay, I wanted to give some resources for a transition to adult care. So one of the very popular one is the TRAC. It is the Transition Readiness Assessment Questionnaire. It's been in use since about 2010, and this questionnaire has evolved now into its 5th version. It is a 20-item tool that assesses for emerging adults anywhere between the ages of 12 and 26, their ability to manage medication, manage appointments, track health issues, talk with providers, and manage daily activities. This specific form can be used on its own, but really it's meant to be used over time, ideally about every 6 months, to monitor the progress for self-management skills. You can find even more information through the East Tennessee State University. They have a link to be able to get a copy of the questionnaire, and then also be able to find out more about the history and understanding the grading of it. Another tool is the READY 2.0. It's a transition readiness assessment for emerging adults with diabetes diagnosed in youth. This was created by Cincinnati Children's Medical Center, and it's a 36-item tool that assesses for knowledge about diabetes, insulin management, health behaviors, and navigation or talking about diabetes on their own. And another wonderful resource is Got Transition. They offer a couple of different resources, one being the 6 core elements of healthcare transition, which is a free structured transition process with customizable tools so that you can find it however you would like to use it for your practice. In addition to that formal course, it also offers age-specific resources for youth and young adults, as well as separate resources for parents and caregivers, and even some additional resources and research geared towards the clinical staff. Okay, so that was a little bit about the healthcare transition and school nurses. I also wanted to cover a bit about what it actually looks like for a young adult moving from high school into adulthood and what that could look like. I wanted to cover a couple of main transitions. So first one is moving away from home. It's a huge life transition for any young adult. So whether they're going to college, to an apartment with roommates, living alone, this change was going to require some adjustments. For one, they're going to be around primarily people that they don't know as well as their parents or their school staff. They're going to probably spend more time alone than they're used to. So if they don't have one already, please encourage young adults to get a medical alert ID so that that works, or one that works with their lifestyle, so that while I hope they never need it, it's one that can keep them safe in their new environment. As they meet new people at school, at work, or other new areas, talking about T1D is a way to not only keep them safe, but also open to more meaningful relationships. However, it doesn't mean that everybody needs to know about T1D. So while the young adults can decide on who knows what about T1D and at what level, this is going to be kind of a new transition from, especially if they've had type 1 for quite a few years. They might not be used to determining who needs to know what and having that conversation. So some people may need to know just the basics, like what diabetes, or that they have diabetes, that they're allowed to eat sugar, while others, such as roommates or significant others, might need to know a bit more, such as low symptoms, where glucagon is stored, how to use it, and when to call 911. So covering these type of topics can be part of that transition process and build some ability for the student to self-advocate. No matter where they're living in young adulthood, taking on that T1D responsibility is a must. There's a lot to learn, so if they're starting out before they leave the house, that can make putting it into practice a lot easier. Ideally, they're already checking in with their parents, their important adults, their doctors, for their understanding of what goes on behind the scenes of a healthy life. Ideally, they're checking in about their medications, how to utilize a pharmacy or a new pharmacy, what the diabetes supply ordering process looks like, when or how to schedule their medical appointments, how to keep track of these appointments, and even how to use their health insurance. And I also like to encourage people to always encourage others for a sick day kit to create, similar to like the ones that they would have at the nurse's office, to contain items that they would need in the event of being sick, when it's harder to think straight, or in the event of an emergency. All right, so health insurance can be confusing as there is so much information that's specific to each plan. So I encourage the young adults to find the important information early on, like where their health insurance card is, what a deductible is, what theirs is, understanding copays and co-insurances. Also where to find this information, such as which medications are formulary and how to find out which doctors or facilities are in network. So as Eleni talked about, some young adults do stay with a pediatric endo provider. Some may stay through college if the provider allows this. This can reduce the mental load to find all new care and navigate that transition while also adjusting to a new part of life. But if not, they'll need to seek out providers who are in network with health insurance well before that appointment is needed, as new patient appointments can be scheduled many months out. Health insurance is a huge topic. So for any young adult that is eligible for Blue Circle Health, we're more than happy to help out. We'll talk about more what that looks like in just a few slides. And big life changes can bring up a lot of emotions. So mix in changes to support system and routine, access to coping strategies. It's completely valid for mental health to need a little extra attention. So encourage young adults to self-check in frequently about what they may need in order to continue forward. If some professional support is needed, keep in mind that a lot of colleges offer free or reduced cost counseling services on campus, and many employers offer EAP or the employee assistance programs that may include some services or resources. Okay, navigating in college can be difficult for any young adults, let alone having with diabetes. So for young adults with diabetes, looking at school can mean a lot more than just the academics. They'll also have to consider how their T1D care comes in, such as how far school is away from home, what health services might look like, how they would get all of their supplies delivered to them. If there's an in-network pharmacy nearby, what kind of food is available. There's a lot of thought that goes into where that next part of life is going to be. Once they've chosen that school, I always encourage taking a look and signing up for disability services. This service combines Section 504 from the Rehabilitation Act of 1973 that they're used to from school, as well as the Americans with Disabilities Act that they'll run into more when they're an adult. And that combination helps to create the disability services. These define any disability as a physical or mental impairment that substantially limits one or more major life activities. Type 1 diabetes definitely fits within this definition of a disability. They may just need a doctor's note saying that they have T1D and what accommodations they might need. Endo offices might have templates for this type of letter. However, if you don't, consider checking out the diabetes link for what kind of accommodations you might be able to request, and if that feels like something as a template that your office wants to develop. Accommodations could include an indoor fridge, ability to check blood sugar when needed, taking breaks from a test to check blood sugar or treat a low, rescheduling exams due to out-of-range blood sugars, or even just notifying professors about the T1D. Even if they don't feel like they need any of the accommodations now, I always encourage students to sign up for it anyway, because it's much easier to utilize it when it's already in place than having to go back when it's truly needed. So Diabetes Link is a wonderful resource. It's one of my favorites to offer for young adults. And that started out as college campus chapters. So there may be one on the college campus that they're going to. If they do, that's a great place to meet other students on campus with T1D. It may make it easier to adjust to life in college, as well as navigating that disability services benefits and any other campus tips. Creating a new schedule, especially around classes, will be a new responsibility for young adults. And that might not be something that they're used to. They might be just getting schedules handed to them throughout their entire life. But consider encouraging them where T1D can fit in. And that can be part of the transition process and just coming up with some scenarios and what it could look like, making sure that classes match what their bodies need. Social life is a major part of college. Finding a balance between social life, academics, and T1D can be a challenge. And there may be some stumbles along the way. So I always encourage people to take a look at Diabetes Link, or if eligible, even sign up for Blue Circle Health for some additional support in navigating these changes. Okay, and then for those who are going on to start a job, starting a job changes a lot of things. For one, diabetes burnout is common. There's a lot of changes that are being processed at the same time. So I always encourage people to check out their support system and how that's grown from family and friends, significant others, your healthcare team, therapists, or even their managers or boss, and where those people within the support team can support with their load. It's impossible to give 100% to everywhere, so I always encourage young adults to consider where they can take a step back, where they can hand off to some support system during a major transition time. So disclosing to an employer is probably going to be a conversation that needs some practice before really getting into the first job. And this is really going to be an excellent exercise in self-advocacy, as the boss may not know much about T1D, and having that conversation practice is going to be a great way to have them learn to express what T1D is and what they may need. Just so they don't get stuck in a situation where a boss is going off of some assumptions or some potentially bad Googled info and lead to a poor work experience. Another big one, if you can cover it before a young adult is moving out of the house or starting their job, but knowing the Americans with Disabilities Act and the protections that it provides, I actually find that this is missing a lot in the patients that I interact with at Blue Circle Health. Many people believe that diabetes is something that has to hide under the table and that whatever happens to you is your fault. So I cover this a lot with people in some of the major areas. So it's a very, very long act, but I brought some major points to it that I like to highlight. So one is that you cannot miss out on a job because you have diabetes. And the potential employer actually cannot even ask about any conditions that you have before a job is offered. Say the job is offered and you do then disclose about diabetes, the employer cannot rescind that job offer due to a disclosure of a medical condition. They might ask for additional documentation or physical, but only if they would do that for any other potential hire. And once hired, the actual performance is going to be the best measure of ability to do a job. Use of accommodations or potential problems from T1D cannot be used against you. As long as the work performance meets expectations, then type 1 diabetes shouldn't be coming up. There are also reasonable accommodations, and when requested, those are required for the employer to put into place for any company that has at least 15 employees. Some reasonable accommodations include time to check the blood sugar, having a private space to check, having permission to keep low foods and testing supplies nearby, making modifications to schedule to account for a doctor appointment or out-of-range blood sugars, or even taking a break time in order to recover from an out-of-range blood sugar. Employers are allowed to ask for supporting documentation, but not too much extra than that. Another major part of the ADA is that the medical information and accommodations are confidential, cannot be shared with other employees, and that harassment based on disability or retaliation from the employer are prohibited. If you need a resource for this, the Job Accommodation Network, or JAM, is a great resource for navigating various accommodation needs. They have a great site on just diabetes, but it also extends to a variety of other conditions. Okay, and then transition from parents being primary caregivers of type 1 diabetes to the teen and young adult being the driver of T1D care should be gradual. So there should be a lot of practice with T1D skills, such as scheduling appointments and using health insurance, refilling prescriptions, a lot that primarily adults are taking care of. Big one is health insurance. It is a very difficult topic to learn completely. So be mindful that it takes a couple of practice rounds before fully understanding the terminology and process. And another important point is helping young adults to understand when a transition within plan might take place. For example, if they're on a Medicaid and they get kicked off at a certain age in their late teens or early 20s, or if they're able to stay on a parent's plan until they're 26, knowing that cutoff can help for a lot of planning. Since health insurance is so big, I do like to recommend the Health Insurance 101 guide found on the Diabetes Link Resource Hub. And then I like to include this quote from the ADA Children and Adolescents Standard of Care, and says the transfer period from pediatric to adult care is prone to fragmentation in healthcare delivery, which may adversely impact healthcare quality, costs, and outcome. So many teens and young adults do struggle in this time of life. The standard goes on to say that resources to enhance social and peer support during transition process may be helpful and valuable. Ideally, with the resources that you've been given for today's talk, that can help you in capacity to, whatever capacity you have. There are quite a few different areas of support here for teens and young adults. Ideally, you'll be using those resources to help to bridge the gaps, especially for a very vulnerable age group. And if you have not seen it before, wanted to highlight this resource that I've been talking about with the diabetes link. It's great and it covers many areas of life, I believe up to age 30. So we recommend it often about many topics. All right, now I'll hand it over to Eleni to talk about our Blue Circle Health Program.
Thank you, Carrie. As we've shared this period of emerging and young adulthood, it's a really challenging time for everybody. And then it can be especially so for people living with T1D. And, so much in life is in transition. School, work, home, relationships, financial stability, health insurance coverage options. And then you add to this transitioning from peds to adult care providers and this whole process of, gaining independence while managing a chronic illness. It can be really daunting. So add on to that, for diabetes care during this time, really neither the traditional pediatric nor the adult healthcare settings are really fully able to meet the very unique needs of emerging adults living with T1D. So transition programs like the one I discussed earlier help. Diabetes Link is an amazing support system. I'm just going to briefly share a little bit about Blue Circle Health because we offer a program that can potentially help fill in the gaps in care that can happen during these life transitions. As I said earlier in the presentation, we're a nonprofit organization and we provide free type 1 diabetes specific care, education, and support thanks to funding from the Helmsley Charitable Trust. And we're dedicated to improving the lives of people living with type 1 diabetes. We offer a number of services. All are free, all are virtual, only for up to 6 months at a time, in Delaware and in 24 states in the eastern and central US. So we're expanding over to the West coming soon. And just as I said earlier, we don't replace existing healthcare providers. We don't provide long-term diabetes care. We work alongside local healthcare providers to fill in gaps in care with a goal to empower participants to manage this condition. And for that reason, one of the reasons why we can be especially useful to young adults during this time of transition. So in this puzzle piece, we list all of the services that we offer. So they are insurance navigation, diabetes supportive counseling, case management, that's Carrie, peer support, diabetes education and nutrition, clinical diabetes care, that's me and two amazing endocrinologists. We have a prescription assistance program to help pay for diabetes medications and supplies. We also have an introduction to CGM program, which provides a free 3-month supply of sensors to those who qualify. So each participant receives an individualized care plan when they enroll in our program. It can include as many or as few of these services as they need. And we take a really collaborative care team approach. We check in with each other and we check in with the participant regularly to ensure that we adapt their plan to meet their changing needs. Next slide. So, who is eligible to participate in Blue Circle Health? Well, anyone who has a diagnosis of type 1 diabetes, is age 18 years or older, speaks English or Spanish. We can fully support Spanish speaking participants. Also, an ability to connect and participate in virtual care. So, usually that's a cell phone with video capabilities because most of our visits are on Zoom. They must have a primary care provider or are willing to be connected to one, and then resides in Delaware or any of these states listed here. There's a lot. We keep growing, or in Washington, D.C., and no current pregnancy. So, next slide. How does someone sign up? We try to make it easy to access our care. Eligible young adults can sign up on our website. You fill out a really brief enrollment form, but they can also call the numbers on this screen, 888-404-4813. Alternately, healthcare providers can send referrals. They can send them by email, by calling that same phone number, or sending a secure fax. And then once a participant submits the online form, or after you send a referral, our clinical enrollment specialist will contact that person within 1 to 2 business days and walk them through the enrollment process. Once someone's enrolled, we keep clinical partners in the loop. We send clinical notes to the referring provider, um, and we welcome questions, calls. I will sometimes call somebody, they'll call me to talk and coordinate, make sure that we're coordinating care. And then, of course, we welcome any additional questions, comments, concerns, records, anything can be sent either through email, fax, or by calling. So next slide. So this is a quote from April, one of our participants who benefited from our Introduction to CGM program and also our Prescription Assistance program when she transitioned from high school to college. And she shared how we helped fill in that gap for her. So I'll turn it back to Carrie.
All right. Yeah, just gonna open it up for any questions. All right, I was checking the chat, and I do see a really good question of how does BCH handle services such as eye exam, foot exams, and lab work. So being that we're a virtual service, we are not able to provide those directly, as much as Eleni enjoys the foot exam. We are not able to do that. So any physical exam needs, we do refer back to primary care doctor, endocrinology, or part of my job as case manager is helping them to get connected to care that is affordable and accessible, that is local to them. All right. Oh, and then I see another one. What is transition after 6+? How is that managed? So once they are finished the 6 months with us, that becomes what they call full circle. It's a little graduation process for them where they're explained all of the different ways that they can access back to their home of either endocrinology or primary care that are directed there for future prescriptions and everything that they need. They are welcome to join support groups that happen monthly that may continue on with current patients and people who have full circled, as well as they're welcome to join any of our events, including webinars and cooking classes.
And then, Carrie, one of the things that you have been doing recently is actually checking in with people, haven't you? At a
Yes.
certain period after they've completed enrollment. Tell us a little bit about that.
Yes, we've started an initiative of a 6 month check-in. So we do have, even though it's a 6 month program, we do have a policy where they are eligible to re-enroll 1 year after their initial enrollment date. really just to say 6 months on, 6 months off. At that 6 month period, we do check in with them. We are collecting DDAS, which is the Diabetes Distress Assessment Scale, just to see. We collect that before the program, after the program, and ideally 6 months after to track just what has changed for them. And if during that check-in it feels like they would benefit to re-enroll with us, they are more than welcome to do that to address any new or remaining distress. And they're welcome to all of the services except for the prescription assistance program and intro to CGM, which are a once in a lifetime service.
And I can handle the Michael, your next question about incorporating apps or other technology services in conjunctions with CGM, and do we work with CSII? So regarding, is that continuous subcutaneous insulin infusion, I believe? So yes, great. Okay, so regarding that, we 100% support people, but we are not actually initiating it or prescribing insulin pumps or supplies at this time. So we will help give education and support. If someone is like, I'm thinking I might want a pump, but I don't know. I don't know what a pump is. We will give all of that education. If someone is already on a pump, but they want help with understanding how does it work, how do I get my numbers better, or I can't get in to see my endo for 4 months and my pump is trying to kill me, we will help them. And so absolutely 100% we connect folks to our portal or to their portal, Tandem Source, Gluco, CareLink. And we're using Tidepool as well. If somebody is using open source AID, which I am using myself, so we're open to um, non-traditional methods as well and helping people with that. So in terms of apps, I love going through people's Dexcom and Libre apps and helping them figure out, okay, well, let's look at how do we look at this data and as a person using this, and what can I learn from it on my own? Because our goal is really to empower people to manage this day-to-day 24/7 condition, and advocate for themselves and empower them to really take control. So that's our goal, is in 6 months to empower them, to get them set up with a beautiful, wonderful medical home if they don't already have one. Does it always work? No. And that's why Carrie checks in with them. But that's the goal. Do we have other questions?
Oh, I found a different box. So
Oh, there's
for Q&A, can a parent enroll if their child is under 18 with diabetes? Unfortunately, no, we are not able to assist with pediatrics. So, but once they hit 18, then we're more than happy to help out. And then how often do they meet with you in 6 months? We are at a capacity right now where we are able to see them pretty much as often as they need us or as little as they see us. I have some people who check in more frequently, especially compared to what they would be able to do with a home endocrinologist appointment availability, to fill in the gaps. We have others who don't need us as often and go more the regular endocrinology schedule, and that is okay. We're really kind of non-traditional to really meet their needs rather than forcing them to meet our structure. Is there a potential for drop locations for supplies at school nurse's office for those with transportation issues? Let's see. So we are virtual, so we are not able to support as far as supplies goes. Which is the unfortunate part. So we are looking for places and trying to connect if there is a local support in any way. We have a lot of patients in Florida, and there's some Florida resources that we can direct to do more hands-off. But unfortunately, we are limited there. Am I missing any questions?
Well, so I did not see those questions, but I see another question from Michael. So, Michael, I'm gonna just share our website with you briefly. So bluecirclehealth.org, if you go up at the top, there's this tab called News. And then so we've only been, how long have we been seeing patients? Like 2 years? We're new. And we started in Florida, and then from Florida, we kind of tested it on a small model, and then we expanded. So, and we're moving pretty quickly. But here are the um, publications that we have out now. I know Dr. Gomberg is currently at ADA. Um, in at the clinical update course, and we'll be presenting there. So here's some information. You can always sign up to get news and updates. So as other things are being published, pretty sure they'll be put there. Um, I don't know if that helped. But okay, so while we're here, while I'm sharing this page, I'll just share. So, if anyone is interested, like these are, and of course, this is all for people living with type 1 diabetes, but here's our events. Our group sessions are only for current or former participants, but our webinars are open to anybody. And we also have, upcoming this month, Finding Community in T1D. And then next month, Advocacy Made Simple, an intro to DPAC. Um, then in April, also, diabetes, Jenny Fernandez with Diabetes Digital, talking about shame and guilt around blood sugar. And then Rita, one of our dietitians and diabetes educators, hosts a monthly cooking class, which is super fun. So this lists the ones that are upcoming, but then there's also past events and video replays where you can watch those. Anybody can. So yeah. Thank you for asking. Um,
Okay. Actually, the Q&A looks like Morgan is capturing most of those questions. So if you're putting anything into Q&A, as you might see a written response from
oh,
Morgan
there it is.
is popping up for you. It came up
I
in a weird
just
spot on
found
my
it.
Zoom.
Sorry.
Let's see. Don't s Eleni, were you sharing the Blue Circle Health page this whole time? Or were
I
you talking through
was.
it?
I thought I was sharing it. Was I not sharing it?
I don't think it overrode my screen.
Oh, it didn't then.
Okay.
So sorry. Well, we should put
Can you grab the URL and pop it into the chat?
yeah. So no, the answer to that is no. So all of these events are developed for people who live with type 1 diabetes and not for healthcare providers. So we do not offer any CEs. Uh,
So Eleni, I was seeing your website when you were sharing that.
Interesting. Okay, well, that's
It
good.
looks like Michael said he could see it too, so not sure what happened.
All right. Well, there's a link to the past
BlueCircleHealth.org.
event. But you can click on upcoming events. That'll just take you to our website. Yeah.
Awesome. Well, if there are no further questions, and thank you guys for monitoring all, you just made my job really easy.
Thank you, Morgan.
Oh, well, going
Oh,
through, also had some references if needed and contact information if you need to reach out or have any desire to reach out to Eleni or myself. Also, our community engagement team is wonderful if you have any questions about our program or have anything beyond the clinical side that you'd like to talk about.
thank you so much
Thank
for
you.
having us. We really appreciate this opportunity, and Carrie and I are both so passionate about transition, and helping young adults with T1D get through this. So thank you. Really appreciate it.
Thank you both for your time tonight and for sharing. And I was connected with Sarah early on, and she when Blue Circle Health first came into Delaware, and I'm so thrilled that we can share it with everybody else.
Thank you. Okay, bye.
Awesome. All right. Well, we will move into our next presentation, which is the NASN Toolkit for educating families about early detection screening for type 1 diabetes. And our presenters this evening are Deborah D'Souza-Vazirani is NASN's Director of Program Evaluation, Grants, and External Partners, leading national efforts around type 1 diabetes awareness and screening with more than 20 years of public health experience. And she's partnered tonight with Rodney Lapointe, and he's NASN's lead nurse planner for conferences on online education, bringing over 25 years of nursing experience, including 2 decades in school nursing and extensive emergency care experience. So thank you both for joining us tonight. And you can go ahead, Deborah, and share your screen. And I'll pop back on when you're ready to take questions.
I'm just trying to get the slideshow. Sorry.
Sure. While you're doing that, I'll just say thank you so much for having us and inviting us to participate in this wonderful program. And before we get into our stuff, how about Carrie and Eleni? Wow, man, what great work, some jazz hands for them. Great work that they're doing over there. I'm sure that families, it's all about families and community and students making that transition into the adulthood care. Wonderful resources, y'all. I hope y'all really kind of reach out and put them to the test because it looks like they are ready to help your family. So what a wonderful job. What a wonderful job. Again, my name is Rodney. I am the accredited provider program director for NASN through the ANCC. I do all of the education accreditation and the lead nurse planner for our conferences. And if you attended our conference in Austin this past summer, you probably heard me speak a little bit about our professional documents and our professional guidance, um, clinical practice guidelines, toolkits, manuals, all those kinds of things that we have available for use by school nurses across the United States and all of the US territories. On our website, it's learn.nasn.org. You can click on the tile for clinical practice guidelines, toolkits, and manuals, and you can access all of those professional documents absolutely free of charge. You don't even have to be a member to access any of those clinical guidelines and toolkits and things like that. You may have to create an account just to access them, but even that's free, super simple. And you're welcome to download any of the toolkits and CPGs that we have there on multiple different conditions, medical diagnoses, and absolutely just draw them down and start using them. But today we're going to be talking about a program that we have been working for the last, Deborah, like a year and a half, something like
2
that.
years. Yeah.
Yeah, on the type 1 diabetes screening program. And this toolkit put together has a number of different features and otherwise other uses also that we're going to speak about a little bit today. I'll go over the toolkit and all of its features and what it offers you as a school nurse. And then Dr. Vazirani will go over the program and the pilot study and what we've learned so far. So just as an overview there. Essentially on the toolkit, as we produced it in collaboration with Sanofi, the purpose of the toolkit is always to provide school nurses with evidence-based, science-backed information for both the school nurse, really the school nurse and the staff and the parents, right? The community. Because a lot of times our job's not done until we educate the community, and you guys know that, right? Y'all are school nurses. And so knowing that you all are the school nurses there and how you're going to use this toolkit Uh, I know we all certainly at NASN know that we're preaching to the choir on this. This is really more of just familiarizing you with what's in the toolkit and how you can use it, okay? The intent is to raise the awareness and educate the families again, on everything, not only diabetes itself, but this new thing that everybody seems to be just finding out about right now, which is the screening process and the labs that go along with that screening process. And then, luckily, and part of the beautiful thing of this toolkit is there's also resources there that can help you to get the word out. There's the tools to facilitate those conversations, as you see there under purpose. Once again, it is a downloadable PDF free of charge at our website. I already mentioned that part, and is free of charge. But again, you may have to create a NASN account, which is okay, free of charge. You could do that as well. It's just so we can keep track of the numbers of who's accessing it at, and keep track of the numbers. Next slide, Deborah, please. Okay. So if you go to learn.nasn.org, you can access it there through the CPGs and toolkits tile. But you can also access it through this hot link that you're going to have access to after the training is over. You'll have access to all of our slides, and you can use this hot link to get there to that same page. And it's that lower left tile there. That's just a screenshot of the screen when you get to that website. It's that bright purpley tile that talks about educating families about early detection, right? That's the tile. That's the one that you're looking for to access this toolkit. And so once you click on that tile, this is the view that you're going to see here on the right side of your screen, educating families about early detection. And this is the toolkit that you can download. Print it off if you want to print it off, throw it in a folder, save it to your favorites if you're like me and don't like to burn trees, and you just want everything electronic. You can download it and save it to your favorites electronically as well. So very, very versatile resource that you can access to use in your daily practice. Okay. Next slide, please. The features of the toolkit itself are broken down into three different areas. And the first area is the introduction. And once again, we at NASN know we're preaching to the choir. We're not going to teach you, the school nurse, anything about diabetes. We know that. Y'all are the experts. Y'all know the ins and the outs and the care and the medicines and everything, right? But we still want to give you everything at your fingertips, located in one place that you can access to educate the families, the communities, the school staff, the teachers, right? The administration, anyone really. So in this toolkit, there is information there about diabetes in and of itself, what it is. And then there's lots of information there about the screening process, okay? We also have available in this toolkit for you a lot of online resources about the T1D screening, but also T1D itself, okay? Um, there is a decision tree there that kind of helps you through that process of deciding, do I need to refer this student and the family to the doctor? Do I don't? Where do we go from there? So there's a decision tree there, and it's based on a couple of different aspects. We're going to go over it in detail in just a moment. And then, of course, there's the referral guide. Next slide, please. In the last two sections of the toolkit, you have other resources. There's the one pagers that you can print off. That's information both about diabetes as well as the screening process itself. To print it off and just hand it to the parent, and send them off with information directly in their hand. Also, other information there in the way of like resources so that you can refer not only the parent and the community, but the school staff if you need to other resources, websites, other what I call the gurus of diabetes, some of those organizations that have information online that you can just send them to. Give them a hot button link and just let them click it and just go right in and get all the information that they need. Last section in the toolkit is really cool because it's that part that I mentioned that are ways to communicate the information, how to get the information out there and how to educate the public in ways that they nowadays want to get their education through quick email blurbs, through newsletter blurbs, or even through social media posts. And now we're going to look at some of those as well before the end. Next slide, please. So again, we know we're preaching to the choir here, but if I'm going to truly be able to support you in the best way that I can, I'm going to make some things really easy for you so that when you're there and you're standing there and you've got this captive audience, right? This parent that's standing right there, that's hanging on your every word as you're educating them, uh, don't really want to just think about, okay, but what were the most common signs and symptoms of diabetes? Don't worry, it's right there on the page. We have, this is just a screen grab again of just part of one of the pages in the toolkit where we have the graphics readily available there for you. And you're able to just see it and just can rattle them off on the fly, with the parents and educate them as you go. So do know that it's not all just text. There's a lot of graphics in this toolkit that kind of help just make it easier for you to just deliver this content in as easy as possible way. As well as if you were to print it off, now you've got it in a form that you can just put in the parent's hand and they can walk away with what are the most common symptoms of T1D, right? And it's on a page with other information about diabetes. So a lot of really great features in the toolkit itself. And once you get in it and start really kind of moving your way through it, you can really begin to appreciate how it's laid out. Next slide, please. We also have a graphic as well of the referral process. I do want to spend a moment here real quick just talking about that referral process because I've been a school nurse for over 20 years and an RN for 26 years now. I just renewed my license. I have to adjust my speech on that. But the idea here is that sometimes when we get through our referral process and we're talking with the parents and we get them connected point A to point B and we send them off to go find the appropriate care, that follow-up, right? That follow-up process, so very important because it does a couple of things for us at the school. Number one, it conveys to that family that we really care about this child and what's happening here, especially if this is like one of those scenarios that we're going to be talking about at the end, where I'm going to give you a couple of different scenarios where I really feel like you're going to use this toolkit the most, right? But this really does convey that we are concerned and we care about this child, the student that we referred, and that follow-up process is really, really important for that. And it also makes the parents feel supported in a way that that I've often heard from parents that say, that's that nurse at that school, man, he gives us really great service. And I've always felt like my child is safe in his care. So that follow-up process is really, really important for conveying that message. But the other thing that it does as well is because as an educated school nurse, you already know if this diagnosis comes to fruition, and it comes to pass that you now have a newly diagnosed diabetic in your school, there's a whole slew of things that are going to begin to happen like dominoes and start to fall one after the other, that you're going to need orders and medications and therapies. And we've got to set up a 504 if the kid's not already spec ed for some reason. And so by having this follow-up feature in the referral process, it just gives us that as early as possible window to begin to act as the go-between from the parent to the school, from the parent to the school administration. We will talk to the administration and say, hey, look, I just had an update from the mom on this student that we referred last week. I know he's been out a lot, but he was really, really sick. He got diagnosed. He's going to be coming back with therapy and orders and all kinds of stuff for us to be carrying out here. So to make this reintegration back into the school as seamless as possible, we're going to need to begin to start talking about things like a 504 meeting and who do we need to get that on their radar to begin to plan that out from the school angle, and just kind of grease those wheels and make this process go a little bit easier for the parents and for the student, really, because we want that integration back into the school to be as easy for the student as possible, right? We have to sometimes think about it from a different perspective too, in that this student, right, who has probably been dealing with these symptoms for a long time, it now has a very real diagnosis that has lifelong impacts that this student probably very well knows about because of their parents or their grandparents or their other close-knit family who are all diabetics, who have probably seen them go through a long history of all of the impacts of diabetes on their life, and now they're thinking, wow, no, I got it too. There's a whole mental health impact that we have to also be prepared for. And by starting here with the referral process and the follow-up phase, super, super important to show that we care. Okay, next slide, please. The decision tree. So I've already made mention toward the decision tree here a little bit. This is for the school nurse, right? And it kind of begins with this scenario where you're standing there with the parent and you're conversing back and forth, regardless of how we got to this point, which is those scenarios that I'm going to touch base on right before I turn it over to Dr. Vazirani. But however we got here, we're basically in this situation now, like it says here. And remember, all of this is in the toolkit, right? But you're there, you're having this conversation with this parent regarding the concerns about the possible T1D issue. And the first question is, but does the student have symptoms right now? Right? And there's one or two possible answers to that question. And depending on the answers, you just move through the decision tree and do that next step that it talks about in the decision tree, right? I'll leave those discussions to you to look at as you go through the toolkit based on what those answers are, because I really don't want to steal a lot of thunder from those scenarios that are coming up, but we'll talk about that when we get there. The second question is more of a follow-up question. Doesn't really have an impact too much on whether or not I decide to refer this person, student or parent or whoever I'm talking to, to a healthcare provider. But it does have some impact on my understanding of where this could have come from, right? So the second question as a follow-up is, does the individual have a familial history of T1D? Here's something really, really, really important that not even I knew before we started working on this project. 90% of everyone who is newly diagnosed every year type 1 diabetic has no familial history at all. I know. I know. I said, what? Really? No familiar history? He says, yeah. And if they do have a familiar history, it actually raises their risks by 15 times. So there is this difference in a scenario that we're going to talk about when you're most likely going to be using this toolkit. And it's going to differ in that respect that if the child had symptoms or not at that moment, right? Next slide, please. All right. In the toolkit, there are a number of resources that you can just access either electronically, so you can actually, link them to an electronic message in any way that you communicate with your parents, and send them off as hot button links, or you can print them off and hand it to them in their hand. But there are a number of one pagers that come right out of the toolkit that give a lot of really great information, both again about type 1 diabetes as well as the screening process. And then there are a lot of online resources there as well, to help educate them. Next slide. Now, we had discussions about this aspect of the toolkit at length when we were designing the toolkit. Because as a healthcare professional myself, that I refer parents for healthcare issues all the time, right? Not just diabetes, but all the time. I know of the ethical issues that are raised when we don't refer them when they need to be referred, or if we feel professionally in our decision making that they would benefit from having that referral. But understand that it's simply a referral. It doesn't actually make them do anything, right? Well, the idea here is that parent still needs to be the one that makes the decisions for that student as a minor, to seek appropriate care. And even though I will make every effort to explain to them the most important reasons why they need to follow up with their healthcare provider to be screened, to find therapies, to get medications, to whatever the issue is, right? We still kind of have to accept that parent can choose to not, right? And they can choose to seek the screening on their own. Well, instead of just sending them off with no guidance at all and hope that they do the right thing, we're going to arm them with some information on what they need to go and find the screening, right? So again, these are screenshots out of the toolkit itself. So you're going to have all of this information just the way you see it in the toolkit, to be able to just print it off and hand it to them in their hand if they're asking for it. But there are a number of commercial and community labs that are out, in public, where they can go to request the lab work. And to make it even easier for them, we've also given them the codes for the labs, the specific labs that they're looking for. That's that list on the right side of the screen where it says what to order. They also have to have the related diagnoses codes that go along with the justification for those labs being requested. So we've given them those codes and those diagnoses as well, so that they can still seek the screening, and at least get armed with the information of what those lab work is going to result and say, right? That will help to grease the wheels to get them to go follow up with the healthcare provider, if they had the results in their hand saying likely type 1 diabetic at this point. So know that all of this information is in the toolkit. But again, from an ethical practice standpoint, I really want them to go to the healthcare provider to get all of these things done, to get them ordered, and to open that line of communication with the physicians or the PAs or the MPs, whoever the healthcare provider is, so that they can follow up with them and they can make sure that they're getting, the proper follow-up post the screening tests. Next slide. Last part feature of the toolkit then is again the sample newsletter uh, blurbs that are in the toolkit itself. Remember, the toolkit is a downloadable PDF. It's already electronic. So the things that you can do with this thing are almost endless, right? So the way that we wrote it was, if you had a space in a newsletter where you wanted to put out some information to the community about diabetes, you could literally highlight, copy out of the toolkit and paste it right into your newsletter, right where you want it. It is customizable so that you can put your school's name on it, your whatever you call your newsletter, the Bobcat News or whatever, you can adjust it and make it yours, but it's the information already pre-written for you that is evidence-based, science-backed information that is quick and to the point, very concise, and is really what we want them to know. So you can just, again, highlight, copy, and paste right into your newsletter, as well as into an email if you're communicating directly with a specific parent and you want to give them information, write in the toolkit again, highlight, copy, paste into the email, and it's all of the information where you don't have to go and find it. You don't have to figure out what do I want it to say, how do I want to word this, if you're going to draw it up yourself. It's all already pre-written for you in the toolkit. So you can definitely copy and paste and drop it right into an email to that parent or to a group of parents or, however you're communicating with them. And the one that I really love is something that's happened to me a number of times at my school, is when your webmaster, whoever that employee at the school is, that's in charge of managing your school's website or social media pages or whatever, you know, comes by your office and says, "Hey, I was wondering, I need something for our social post for this month, and I haven't asked you for anything yet. So I was wondering, do you might have something that you could contribute that we could highlight for this month's social post?" Hey, yeah, definitely. Here, let me jump in this toolkit and I'll get you something, right? It's already pre-written, perfect for a social post, real concise, couple of sentences long, real to the point, and even might refer them to a resource that you really want them to go to, right? And use it as kind of like a stepping off point, right? Or a jumping board to another website that is loaded with information. And you're connecting them again, you're sending them in the right direction. And all of these social media post examples are in the toolkit that you can again just highlight, copy, and paste, and boom, you're in. Customize it to your school, change a couple of words here or there, whatever you want it to say, and off it goes. Simple, real simple. So I really do like this toolkit for this reason. Okay, next page, please. All right. Let's get into those scenarios that I was talking about, right? Let's be school nurses here that shine brightly, right? So the first scenario where I really feel like you're probably going to use this toolkit the most is the parent that comes to you. Okay, let's put it that way, right? when the family already has a diagnosis in the family, right? And especially if it's one of the children, the siblings, right? They're already well informed, okay, super educated because of some of the work that people like Carrie and Eleni do every single day. And they're very well educated and versed on therapies, medications, diet, exercise, where it came from, things like that. And when they have other children, siblings to that student, it doesn't take them no effort at all to point A to point B something else and come to you, show up in your clinic, and next thing you know, you're having this conversation about what are the chances that my other kids may develop this condition as well. Well, hey, let me pull up this toolkit, and I want to show you a few things, and I'm gonna print off a couple of these forms, and you can take them with you. And I definitely want you to have a conversation with your endocrinologist, who your child probably already has and is working with, or the PCP or whoever those healthcare providers are that are controlling his therapies at this moment. You're going to have a conversation with them, but I'm going to arm you with a bunch of information here. Let me print off some pages. Here you go. Take these with you. You can read these on the way. But this is really going to start to kind of lay the foundation of where you're going with this idea about the levels of risks, right? And we've already mentioned that if a family has a familial history, that already elevates their risks 15 times for the non-diagnosed family members, okay? That risk is already there. And this is in the toolkit, right? The information is already in the toolkit explaining all of this. So this is really where I feel like the probably one of the scenarios, not the most obvious, but one of the scenarios where you're probably going to use it. And I do, I like that we even point out here, like page 2 and page 5. Look at those pages in the toolkit. Likely be the most impactful for this family. Okay. Next slide, please. Next scenario. This is probably the likely scenario that you're going to run into as a school nurse. It's when you are seeing this kid, when this kid comes to your clinic and you're seeing him again and again, same complaints. You do your head to toe physical assessment. It's not really connecting to anything except that you see him pretty regularly. And now you're starting to think, is there a possibility? What were those common signs and symptoms of T1D again? And now it's starting to, uh-oh, here comes the light bulb, right? Cha-ching, light bulb. Who? All right, let me call mom. Get on the phone, get the parent on the phone. Hey, look, I have this suspicion of this going on, and it's based on all of these signs and symptoms. It's based on the number of times that I see him again and again with the same signs and symptoms, usually around the same time of day, even, you know, a lot of those things that you can pick up on. Okay. And then you start to get some of that, the other things, the color, the fruity smell of the breath, the other symptoms that were either double H or we're DKA at this point, right? And now I'm telling the parent even, I think he needs to go straight to the hospital. This could now be literally, especially if it's DKA, could definitely be life threatening. One of those don't pass go, don't collect $200 kind of things. And if you're old like me, you know what that means. But you call the parents and you say, look, you need to come and get them, please. Come and get them. This is the reason why, and I'll have them here when you get here. So as we're waiting for the parents to come to get the student, I'm printing off this information out of the toolkit, get these pages, and have them ready. And when they come to get the student, hand them the pages, say, here's some information on it, this where what I was talking about and what's fueling my suspicions. Please give me a call in the next day or two. Let me know how he's doing and where we arrived, because I'm really going to be worried about him until I know that he's okay. Yes, I want to know because of all of the follow-up stuff, but I'm communicating that I care about this student, right? I'm just going to really feel bad if until I know that he's okay. Please let me know if my suspicions were right. Okay, Mr. Point, I hope you and they go, right? So this is likely the scenario where you're going to really want to have that toolkit available and have it, where you can access it quickly, even if it's electronically, and print off a couple of those pages, like page 2, page 5, any of those other pages, and hand them to the parents when they arrive to come and get the student. Next scenario, please. Next scenario, please. The last scenario where I really feel like you're going to use this toolkit is exactly for that last section that I spoke about, is either your district is in a state where there is legislation that has been passed. What, Deborah? We're up to like 16 states now that have legislation where the school is being required to disseminate education to the families about type 1 diabetes. I know, right? This is becoming wildfire, and now we're up to 16 states in just a couple of years. So if you're in a situation where your state is making you disseminate this education, draw it right out of the toolkit. It's already built. It's pre-written. Remember that whole section for newsletters and emails and social posts, right? Or if you just want to get the information out there, just share information. That's totally great too. You definitely can pull it right out of the toolkit. Maybe you're not under regulation to do that, but you can still do that, right? But it is in that scenario, as a result of disseminating that education, that a parent shows up in your clinic with those questions like, well, what are the risks that their siblings will develop this condition as well, right? Hey, toolkit, toolkit time. So those are really the three scenarios where I really feel like you're going to utilize this toolkit the most. And so now I'll turn it over to Dr. Vazirani to speak about our program.
Thank you, Rodney. Good evening, everyone. So as Rodney mentioned, we started this work about 2 years ago. It's funded by Sanofi. They really wanted us to create a toolkit to educate school nurses, especially with many states implementing legislation for type 1 diabetes screening education in schools. So we chose to pilot this toolkit actually in 2 states in 2024, Michigan and Pennsylvania. We picked these 2 states. So Pennsylvania already had legislation in the books for type 1 diabetes screening education to be promoted in schools. Michigan still does not. But the school nurses in both these states were very interested in educating their school nurses. So Rodney actually did virtual presentations in both these states. Over 300 school nurses took the training and have been educated. We piloted this toolkit actually in 3 school districts in each of the 2 states. In case you're wondering why, our purpose was twofold. One was to educate school nurses about type 1 diabetes screening. But the second and equally important was how could we improve upon this toolkit? What are school nurses looking for when they see this toolkit and when they review it, and how could we make it better? And we got some really good feedback, which helped us get to version 1 of the toolkit after the initial launch. And so last year we piloted, the relaunch of the revamped toolkit in Maryland, where there's also legislation that's been passed. We have a very active affiliate president in Maryland. She's a certified diabetes educator. She's passionate about type 1 diabetes education. Rodney once again did the training. 400 school nurses and counting have taken the virtual training for CE credit. They've partnered, the School Nurses affiliate in Maryland partnered with the state school nurse consultant to offer comprehensive type 1 diabetes education, including some of the curriculum that NASN puts out and the toolkit regarding type 1 diabetes screening. The school nurses in two counties in Maryland, Prince George's County and Montgomery County, are working with Children's National Medical Center, which is a regional medical center highly regarded in the country. They're working with the pediatric endocrinologist there on how do you refer students from the school districts to these physicians, to these PAs and nurse practitioners at Children's National Medical Center for screening, as well as to document best practices for referrals. That data is coming in, and we're going to be sending it to Sanofi and actually putting it out and hopefully presenting this information at our conference in June, this coming June. One of the biggest requests from our school nurses was to have translated parent resources. So we're in the process of translating our parent resources into 5 languages. School nurses from the 3 states requested the 5 languages that I've, put up here, and Spanish, Amharic, Portuguese, Vietnamese, and Cantonese. And so we're in the process of doing that. And if you go onto the Toolkit website, probably in about a week or two, maybe by the end of February, you will have access to those translated parent resources for you to be able to download and share with your families. However, once we launch this toolkit in more states, and we're hoping to do that this year in 8 more states. We are hoping for feedback from school nurses in those states to share what other languages are they looking for us to translate these parent resources. What are some of the key learnings? So the first one was that, school nurses really requested us to have our resources translated into multiple languages to meet the needs of their parent families. How do you access the type 1 diabetes screening tool if families are underinsured and uninsured? And that's sort of why we decided to do a pilot data collection tool and a study, so to speak, with physicians and practitioners at Children's National Medical Center to determine what if a family in your school district or in the school district in Maryland and DC, if they're underinsured, if they're uninsured, and they don't have access to this to get the screening tool, can they go to a regional medical center and will they have access to the screening tool? So we're in the process of collecting that data to determine best practices, which once again I don't have access to right now, but hoping to present that information at conference this summer. The other, feature or the other issue that probably many of you are dealing with is lack of access to pediatric endocrinologists and large medical centers. Our school nurses in Pennsylvania, who were part of the pilot project, that was the biggest concern that they raised. How do you refer a family to a pediatric endocrinologist when there's not one for many miles around or a large medical center? And sort of what are some of those best practices? So, we are once again collecting that data to determine what are those best practices that those school nurses working in rural school districts, what are some of the tools that we can equip them with to give them to help them help the families that come to their schools. Another big issue that school nurses shared was the difficulty communicating with pediatricians due to lack of awareness of type 1 diabetes screening. And this is something that we've been actually bringing to the attention of ADA Safe at Schools Committee, Beyond Type 1, Breakthrough Type 1, the Diabetes Leadership Council, Sanofi, any place that NASN is invited to speak about the piloting of our toolkit and the education is sort of this number one, how can school nurses, as a trusted health educator in schools, as a trusted and the expert public health specialist in the school, communicate with the pediatrician their knowledge and what they're seeing in their students, and how can they help their families go to their healthcare provider and have the appropriate conversation that Rodney was sharing the tools that we have in the toolkit for. So just wanted to share some of this. Um, that is kind of all we have. As we go into so the next phase of our project, we're looking to update the toolkit. How can we make this education tool the best possible way with the most up-to-date information for all of you, not just for school nurses in states, the 16 states that have this legislation passed, but school nurses all over the country. Here are our email addresses. Please feel free to reach out to us. Um, my last thing, and this has nothing to do with type 1 diabetes, but I'm just putting it out there, especially for Delaware school nurses. NASN is conducting a workforce survey. We really want to build a national comprehensive evidence-based understanding of the school nurse workforce. Right now, if you're a school nurse from Georgia, Georgia school nurses, we have about over 300 who've responded to this survey. We have only 24 Delaware school nurses who've taken the survey, so we would love to have more representation from Delaware and some of the other states. Here is the link and the QR code. Kind of gone a little bit off script, but would love to take. You will get this presentation, I think, from Sarah. And once again, on behalf of Rodney and me and NASN, Sarah, thank you for inviting us to present this information to your attendees.
Yeah, thank you so much for the opportunity or for being here and for sharing the information with us. I do see a few questions in the chat, and
Right.
so I'll read them off here. As a school RN, there are now three toolkits available for my use: Safe at Schools, Reboot Diabetes, and the NASN Toolkit. With multiple toolkits coming out via available funding, is there one in particular you recommend after family reviews?
I
Well,
honestly, I mean, I realize that there are other organizations that are active in this area and doing ongoing research as well. Our program, in collaboration with Sanofi, who actually has been in the business with the screening and diabetes care and therapy development for decades now, their research has actually been ongoing for a little over 10 years in this area. And so we joined forces to produce the toolkit. And to get to our second part of that, of the question, actually the next question on uh, when NASA's research is over, we're actually still doing it. That's the program, right? The pilot program that we are currently undergoing for the next phase to finish developing and further develop our toolkit to make it exactly what school nurses need it to be. So we're definitely welcoming input, as we go through this next pilot phase. And if you get a chance to use it, you want to drop us a line and tell us how you liked it or didn't like it, great. That'll help us to finish developing this toolkit for sure.
And I'd like to add to that that every year when we have a toolkit review and we have experts from ADA Safe at Schools, so Dr. Frank Kogan from DC Children's National Medical Center, Dr. Christine March from Pittsburgh Children review this toolkit in addition to subject matter experts from Breakthrough Type 1 Diabetes and Beyond Type 1 Diabetes, and our school nurse subject matter experts who are diabetes resource education, specialists. So that is sort of the research that we're doing. We recognize that the type 1 diabetes space and the information is continuously evolving, improving, and we don't want it to be old information. We want it to be as current as possible. So which is the reason we've done an annual review, and now we're in our third update of this toolkit. So that we are giving school nurses, if they choose to use this toolkit, the most up-to-date information.
Awesome. Thank you. Next question. Why are you not able to deliver to schools? Is it a legal reason?
I just was curious, is when they say deliver, do they mean the screening tool, the test? Is that
Not
I
sure.
I thought maybe that was a holdover question for Carrie and in
Oh,
Eleni's presentation. I know they mentioned something about supplies, but their program is virtual something. I
Hmm.
defer to them. I apologize.
Yeah, I don't know. It came in at 7:52, but if it's an anonymous member, so if you're still on, if you want to elaborate, we'll come back to the question.
Yeah.
Next one. One additional question. When was the research completed by NASN on this toolkit? My district would want to know for our nurses.
so the current version online was updated in the last summer, but we are in the process of updating it again. We have it under review. So the version you have has, I would say, 97% of the resources are current. There may be a few that, either ADA or Breakthrough or Beyond have updated, and those will be included in this next version, as well
Awesome.
as the translated parent resources.
Great. Um, and this is just more of a plug and a praise. So your national conference is in Las Vegas this summer, correct?
Yes, it is.
Yes, it
Yes.
is.
And
Yeah.
so our own Amy Hastings will be there presenting on our Lions Club grant and the partnership that we have in Lions Empowering School Nurses. And so if there are any Delaware school nurses that are also going to be in Vegas, please make sure you go and support and give her a big cheers and kudos. So,
And I want to personally invite every Delaware school nurse
Yes.
to come out and join us. I mean, for no other reason. It's in Las Vegas, y'all. Come on, right? But yeah, I mean, our conference is 4 days of really awesome education, empowerment, networking. It's quite an experience, and I invite everybody, to
And
come
an
out
extra
and
plug, I've
join
heard
us.
Amy speak, and she's an excellent presenter. So um, definitely, if you're coming to conference, go to Amy's session.
yes. Yes.
Absolutely. Yeah.
Absolutely. I'm so passionate, so passionate.
Yes, absolutely.
So, all right. Well, with that, I think, oh, yep. Okay. The question was for the other presenter. So all set there. But so thank you again to all our speakers tonight for being here, for our attendees for being here. And we had, like I said, record numbers this year and continue to grow that year over year. So I need to grab the um, evaluation link for you, and it will also be coming out in an email in about 4 minutes. But if you are still online, I'll drop it in the chat. Here it comes.
And thank you all again for having us. I do want to really say thank you so much. We appreciate it.
Yeah, awesome. Well, with that, I will give everybody back their night. Thank you, and we will see you all next year.
Thank you. Have a good night.
Thank you.